All right, we should be live.
Okay,
I
there we
see the timer
go.
ticking down, and I'll just double check on YouTube here in a second, but I'm going to assume we're good. So, all right. Well, welcome to the next installment of, there we go. Next installment of the Eviva webinar. We have some real patients here, Charles and Mike, and Dr. Tan. And we're going to talk about, all things weight loss, all things surgical weight loss, talk about their stories. What's the journey of going through surgical weight loss? What are the different tools that we use, like the injectable medications? If you have questions and you're following along live, you're welcome to put them in the chat, in the YouTube chat, and we will try to address them in a timely fashion. And we have a couple questions that we recently got from some patients, and we can kind of chip some of those in there. But otherwise, we have just a bunch of questions. We can talk about Charles and Mike, what your guys' experience was, and yeah, looking forward to it. So,
Yeah.
without further ado, Dr. Tan, I'll introduce you. You are the bariatric surgeon here at Eviva. And then maybe say just a second about yourself and then introduce your patients, Charles and Mike.
Yeah, absolutely. Well, yeah, so I'm the other bariatric surgeon. I'm on this every once in a while with you. But I am absolutely thrilled that Mike and Charles are here with us today. We were just chatting before we went live that it is their 1 year surgery anniversary as of 5 days ago. And Charles and Mike are best friends. And I
Yeah.
saw you both a couple days apart for our first consult meeting. And I had to connect the dots when we first met because you both also live not in the same city. Like you guys are
Correct.
quite a bit
Correct.
a ways. And then you both had surgery on the same day. And it's been really cool seeing you guys at intervals along the way, but this is my first time talking to both of you kind of in the same,
Together.
not in the same room, but in the same room-ish since your surgery. So that's really cool. So yeah, I think we should just kick it off and start with some questions, I'm thinking.
Great. Maybe Charles and Mike, maybe you guys introduce yourself. Like, what was your life like before? What got you to say, hey, I really want to, I'm really interested in pursuing surgery because I just
Mhm.
feel like I'm in a spot that I'm stuck.
Mhm.
Yeah.
I think,
You want me
go
to
ahead,
go?
Mike. No, go
Okay.
ahead.
So for me, like weight has been something that I've struggled with my whole life, and it's been one of those challenges where like I've kind of tried everything from like doctor support to the fad diet things to trying to be just consistent and doing better, and I was never able to really break the chain of losing a little bit and then gaining it all back or more. And I kind of always promised myself that this option would be something that I would pursue if I couldn't figure it out any other way. And I kind of hit a wall last year. Actually, it went pretty quick as far as the turnaround from me making the decision to surgery was only 2 months. So December, October is when I kind of I had the conversation with my wife and we aligned on like we're gonna move forward because I was tired of it. I was tired of failing, and I wanted something that would be hopefully be the thing, the catalyst to kind of help me reach the goals that I wanted to achieve. And that's kind of what started this whole process.
Yeah, a little different for me. I mean, I really started gaining weight after high school. Um, and it was kind of slow at first and gradual, but food has always kind of been the center of a lot of things that I do. And I think just some emotional stuff would kind of put me in bad places, and then I didn't want to take care of myself. So Um, a lot of my journey has been trying to actually do weight loss with Mike. There's a lot of times that we just tried to help each other out because we, would get to these points of either feeling bad or, we get together and we would kind of center it around food or trying to be healthy, but then we'd fall back. Um, so we really just tried to kind of find different ways to help each other out. And then he kind of started talking about the weight loss. And there was always something in the back of my head when it came to the surgery, but it wasn't one that I like really heavily considered until he actually kind of started talking about it too. And I failed at a lot of different diets. The most extreme one I did was Octavia, where it's you eat a lot of like pre-made bars and you're on this strict 1,000 calorie diet. And I did lose a lot on that, but it wasn't, sustainable in the end. And you don't learn really how to kind of take care of yourself in the long run. Um, so doing this has really just changed my whole life and kind of the way that I see things. And I don't think that I ever really realized how much the weight affected me mentally until it kind of has come off. So I feel like I'm a totally different person at this point. And, a huge thanks to Mike for kind of encouraging me or putting even the seed in my head to do this together. So it's been pretty awesome for me just to have that and that support from him too.
Nice job, guys. Yeah. How much, Mike and Charles, like, how much have you guys lost? How much weight have you lost?
I'm at 96 right now, 96
Wow.
pounds.
And I'm down 112.
Man, nice job. Nice job to you guys. Nice job to
Yeah.
Dr. Tan.
Yeah.
What I always say, like, we're all a team. We're all a team. Like, we have the surgeons, we have our parts. You guys are the MVPs of this team.
It's true.
Yeah.
It's true. I tell folks that the surgery's on. I have the much easier job. None of this, I think. It's just the beginning. So.
Right.
What is it that got you guys to say, I'm going to reach out? What was it that sort of was like, now is the time? Charles, how about you?
Oh,
Like I said, with me, and like Mike kind of really put the seed there. I was starting to feel worse and worse, I think, and having health problems here and there. I didn't like none of mine were like major. I didn't have the heart things. I didn't have diabetes, but like my cholesterol started going up, and then just no energy and kind of feeling crappy every day. Really kind of made me make the decision to do it along with Mike's encouragement. So I wasn't didn't feel like I was dying, but I kind of started thinking like I was on that path where I was really going to start having some major issues if I kept eating the way that I was and doing the things I was doing.
How about you, Mike?
So for me, like I had a health scare about a year and a half, about 2 years ago now. That it felt like a heart attack, and I went to the hospital a few different times. It ended up being adult-induced asthma, which good for that it wasn't anything with my heart, but like it was the feeling of like I couldn't breathe, my chest was tight, and I had high blood pressure for a long time. I was on medication for that. My health was starting. I was seeing the impacts of my weight more and more. So I was been put on a CPAP device, which I hated, cholesterol high and then blood pressure high. And I was just kind of at that breaking point. And so that I have a daughter, and I want to be there for her. And so that was kind of like the back of my mind, or the thing that pushed me. And I wasn't as afraid of as I was to make the jump with surgery, because I didn't know how it was going to impact my life as a whole. And I kind of had that fear because I do enjoy food, and there's a lot of stuff that I do around it that I was worried that it would impact my life in a negative way. And I eventually got to a point where it was the health stuff was more. I'd rather be here than not. And so that was kind of the breaking point for me to just say like, okay, let's actually go do it.
And that's a big thing that I hear from folks is, how will this surgery change my life potentially in a negative way, in terms of eating or even like social activities and how I relate to my family. How do you feel like, well, first of all, did you have any other fears about surgery apart from just like the stomach being physically smaller? And then how have things actually played out since surgery?
No, fear wise, I think like the skin part was always one, like the other one, but I was okay living with that, knowing that like the health benefits are going to be there. But as far as like the actual life things, like I won't say it's perfect. It's different. So there's things that and none of them I expected prior. So it was all things that I've learned through this journey. But as far as like eating, like how I eat and the way that I feel and the health benefits, so I'm no longer on medication for blood pressure. I'm not on anything for cholesterol. I'm no longer have to use my CPAP device. Like my energy levels are huge. So like all the benefits of the reason why I did it outweigh anything from the negative. It's just I've had to learn how to be social differently than I used to. So things like going out to dinner and those kind of things, it's not the same. And so like food has kind of lost some of the enjoyment in that way. Like you go out to dinner with people, you look at a menu, like, what is it that I want? I don't look at things in that way anymore. It's more like, what do I like? What can I have? Or what am I going to share with someone versus just ordering something for myself? But it hasn't stopped me from being social. So that's the other thing is it's just been a learning curve that even a year out, like I'm still adapting to and stuff, but I'm more proactive. So I look ahead of time where we're going to go. And I kind of make a plan. So that way I know like when I'm there, it's just like, I'm just able to focus on the event, more so than what I'm going to be eating.
That's really cool. That intentionality, I think, is one of the coolest and most underrated parts of this journey. You know, when you start having that intentionality of this core function of your life, how that permeates into feeling empowered for so many other things is really cool. So,
Yeah.
Charles, what about you? Like after having weight loss surgery and having a smaller stomach, were you really worried about having a smaller stomach, and what has it actually been like?
I think a little bit, yeah, that was like a fear at first. And then beforehand too, one of the big reasons I think where when I would think in the back of my mind of doing it, not doing it was some of the nutrient retention stuff is that, I heard that from other people who had it. And that was always kind of a fear of mine too, is how would it affect me in some of those ways, or maybe always having to take, protein or, vitamins or something like that, which I should be doing anyways, because we live in a society where you're not getting a lot of those vitamins. So I kind of had to rewire my brain that way. When it comes to the actual eating, though, it hasn't been, I think, as big of a deal as I initially thought. So, I was talking to Dr. Tan about this last week, where I don't like completely cut out everything that maybe I liked before, but I've rewired my brain to understand that I can have a little bit and still feel satisfied with some of those things. And then I just try to make sure that I'm getting like a lot of better, good meals and food that I need, or protein, and just kind of rewired that way. So I'll have little things and feel totally satisfied. And I thought that would be really hard, and I thought that I had to have the food, and I haven't needed to. Like, I think that, growing up, I was just trained, you eat everything that's on your plate. So then you get to a point where the plate gets bigger and bigger, and then you want to continue to finish it. And now I can still have certain things and feel good about eating it, but then feeling good about myself afterwards, instead of hitting that cycle of, oh crap, I did it again, or I ate too much again, and now I feel crappy, so then I eat more, and then you just kind of fall into this really slippery slope. So it just kind of rewired my brain to, still enjoy life, but do it a little bit more thoughtfully.
Yeah, that's really cool.
Yeah, that rewiring is so powerful. And we're all capable of doing that, but it is hard. And the surgery definitely gives you the kind of push that a lot of folks need to kind of do that rewiring. So that's great.
Can I say, actually, kind of that's where a lot of people, I think, stall in their weight loss, is that they beat themselves up, that they're like, if I know what I need to do and I just can't seem to do it, and I just need to go harder, I just need to do it better, and then I will be successful.
Yeah.
I'm sure you guys did that in your head for so many years.
Yeah.
What has been the difference of that mindset with now a smaller stomach after surgery?
I think for me, it's like you get instant feedback, whereas before it was easy for me to fall back on old habits because I could just do it, right? There wasn't anything but myself or my brain stopping me. Whereas now, I made a big choice. So I need to kind of make bigger decisions in the long run to make sure that the choice was worth it. And then plus, yeah, just if I eat something my body doesn't like, or I don't overeat, but if you kind of get to that little point, I feel so bad just from a physical standpoint that it makes me not want to do it the next time. So it kind of retrains me in that way. So I kind of learn to not create bad habits for myself because it makes me feel a certain way.
Mike, how about you? What's been like? Because I think was the way, like, kind of to reiterate it in a different way is
Yeah.
a lot of people are like, here's what I know what the course of success is, right? It's
Yeah.
healthy food in the small portions.
Right.
That's the key. And I think most people just feel like their body's just trying to constantly just yank them off of that track, off of that path. How has that been like after surgery?
For me, it's like I got accustomed when I for a long time that I enjoyed being full. Like that was the result of me wanting to eat a meal, was I wanted to feel satisfied at the end. And with surgery, you get that, you just get it so much faster. And it is that at that point where then, like, now I'm more focusing on, like, I had to completely relearn how to eat. Like I used to before, like I'd save the best for last. And I and now I don't do that, because then it's a waste. Like you just waste all the good because there's no way you're gonna finish it. So it was to be honest, like it was a really big shift, and it took time. Like the guilt, like I'm gonna be honest, like I still have it at times if I feel like I'm not perfect, but it's more so of I don't want to fail, because I'm so happy with the progress that we've done. Like I really do feel like this was the tool that I needed to help me get to that point, because I think Charles said it the best there, is like that immediate feedback is so real, and it starts right away. Like day one, like you're taking a drink of water and you're stuffed off of like that, or like a popsicle. You're wondering how you're gonna get through the rest of it, to now where like when I go to make plans and stuff like that, like I don't even base it around food anymore, and it's more of an activity or something like that, which has also been hard to kind of rewire in my brain, but exciting too, because it kind of limited what I was doing before, to now it really kind of opens up the playbook.
Yeah, it's a surgery. It's such a powerful tool. And I think with weight loss, people have been using the lowest tech tool to lose weight for a very long time, which is diet and exercise, diet and exercise, diet and exercise. And we have very strong, powerful, useful tools these days. And it just makes sense at some point to upgrade, so to speak. It's like raking. I live in a heavily wooded area. And at some point, we decided to upgrade to a leaf blower instead of a rake, and it has been very helpful. And so it's kind of a stupid analogy, but I think it is just like all technology and all advancements. It's at some point it makes sense to upgrade. So, Mike, you kind of mentioned that first couple of days and that popsicle and struggling with that, and I know you guys leaned on each other a little bit for those first, I mean, probably this whole time. What was that first month or two of recovery like for both of you?
Rough, but it was, but it wasn't. Like it was challenging in ways that, like, part of it was expected because you told us what to expect, and so it followed that path really well. So it was nice to know what was coming, and then it actually followed that plan. So having that, I will say, doing it with Charles was probably the best thing, because as soon as we felt different, or I almost daily, hey, how do you feel here? Is this what you're experiencing, and those kind of things, and having that immediate feedback with him, and knowing that he'll tell me exactly, like there was no like worry about like being honest or things like that. Like I would wake up with a pain on my side and ask him, and he's like, yep, I feel the same thing. So I had tightness in a bit the very specific spot of surgery, that I had like a very large indent, and I was like panicked a little bit that like, oh, I'm gonna look like this for the rest of my life, and you assured me that I wouldn't. But like 2 weeks later, it's still there, and then eventually you couldn't even tell. But it's one of those, like, I think going through that was a challenge. And then like the diet part, I honestly, that wasn't near as hard as I think me getting through the like the just like the physical of like being sore for a couple weeks and going through that.
Mm. I think for me, I'm a little opposite. So I feel like I just have like my mom says it that we, like us creatures, have a huge pain tolerance. So I felt pretty good even the day of surgery. I was like up and like ready to get around and go. And I think like the next day I was going on little walks with my dog. So the pain part didn't get me, but the meal plan afterwards was a little bit challenging, especially like the puree food part. So it's not unattainable. I did learn a lot throughout that too, I think, just to take into like how I eat going forward. But yeah, that was a little bit rough. But it's also super important to follow along with what is recommended, because everything that kind of was outlined, we were feeling. And like Mike said, we were able to kind of bounce off each other and say, hey, what are you doing here? How did you handle this, or what does this feel like? So it's very important that we followed that. And I think that like mentally also got me prepared to follow the meal plan going forward as well. Because I felt how different it was at that start, and following along with the recommendations, I think made it a little bit easier, even though it was challenging to do, all liquid and then soft and then pureed and then, kind of incorporating things after. But you really lay a good foundation for how the rest of the journey is going to be, just by following along with that. So yeah, the eating part I think was the challenging part for me, not so much the pain. I was good with the pain for the most part.
I will say you appreciate that next step of the diet the day you move from like broth to creamy, or creamy to,
Yeah,
to blended. Like it's like,
feel like I'm
I have a
excited.
whole avenue different now. Yeah, it was that
You
was
never
something.
thought you'd be so excited for pureed food.
No.
Yeah.
Right.
Have Charles, have you ever had dumping syndrome since your weight loss surgery?
Myself, no. Like, and I didn't really have like the into or like heartburn or acid reflux or much of that either. Like, I was really actually kind of scared at first because, of course there was pain and discomfort, but I was like, oh, if some of these things, like if I had to vomit or something like that, like I don't know how that would feel, because I remember sneezing after having it and feeling like that was gonna be the thing that put me down. But yeah, the dumping hasn't been an issue, or I haven't vomited at all since the surgery. I didn't really kind of go through any of those things, luckily.
How about you, Mike? Since weight loss surgery, that's honestly a huge fear that we get like so often. So my most common like watched videos are like, "Do you get dumping syndrome?" It's like it's
Mhm.
all over questions. Mike, have you ever had dumping syndrome after your weight loss
No,
surgery?
it's things like none on the heart, like the heartburn or anything either. Like, I think it's the part of it though is like I have been pretty strict on what and at least more from like a portion size necessarily than like what I'm eating. And so like I weigh, like that's the one thing that I consistently do to this day is like I weigh out my meals, so like it keeps me so that I'm more focused on what like how much I'm eating versus what I'm eating. Outside of like my protein intake. But no, like that was one of the things. Like it was a fear, but it was when that wasn't a detractor for me going to do this. I was more like, is it actually going to help me lose the weight? And we'll just like play, take it if it comes. And I knew that there was medicine that we could take and those kind of things, and we just never ran into it.
Mm-hmm.
Having some excellent surgery helps too.
Yeah.
For sure, Dr. Tan.
Exactly.
So what are portion sizes looking like for you guys now, and how does that compare to before surgery? How maintainable does that feel for you?
Like Ted said that he weighed. I don't necessarily weigh. I kind of try to, which I guess maybe isn't at this point like the right way to do it, but I kind of just eyeball it. And it's, I just take a little bit of everything, where it's like maybe like a spoonful of something. Like I go to my mom's every Sunday and she likes to make a lot of carb heavy stuff. Or I mean, we always have like a protein and then like a veggie and a carb, but she makes big portions. We're a family of, 4 kids. So she's kind of used to that. So that's a lot of where our, eating around the table came from. So now it's just I take a little, and she wants to kind of, do the mom thing of, are you sure you got enough? Maybe you can have a little more. And I'm like, no, mom, I'm good with what I got. I totally feel good. So, it's a spoonful of this and that. And then I try to eat, like Mike said, the good stuff, or like the meat first, because I feel like that is a little bit more filling. And carbs, I don't have the same affinity that I had before. So like if I leave that out because I've felt like I've had my fill, then I'm totally fine with doing that, or not having that. And I try to be smart about whereas before, like, let me fill the plate and then maybe go back for seconds, where it's now I take a little bit and enjoy what I have. And then if I really feel like there's maybe some room, then I could go back for like a bite, but I usually don't even go back for seconds anymore, where it was almost a guarantee before. Or I was like the kid that would eat my siblings' food if they didn't finish it too. So now I'm just like, okay, I'm done, and then I'm usually cleaning my plate and hanging out with my dog after I'm all done eating, and they're still kind of doing their thing. So
That's a pretty cool story arc for your relationship with food. It really is.
yeah, it
What
definitely
about you,
changed
Mike?
everything.
So for me, I weigh out, and like my wife learned too. We just keep the scale on the counter. Right around 6 ounces is what I go for. But as far as like being sustainable, like yes, and to the point, like we'll prioritize, or when I'm weighing it, like what I want the most. And then I'll build out, and once I hit that, I know that like that plate is what I can have. And then like there's times that I still listen to my body though, so it's not like I force whatever I put on there. I just know that I'm not going to go over that. But there's depending on what I'm eating, like some things are just that cause me to be fuller faster. And so I stop, and I'm still learning to not want to finish my plate, because there are definitely times where like I cook really well, and I want to finish what I made. But like listening to my body and knowing that like I don't have to force it. Like we'll either have leftovers or I am satisfied, so that's good. Is something that like still learning. But the weighing thing has been like that's I think the biggest tool for my success, because it takes away from like the guilt and stuff like that, because I know like what I'm making and what I'm eating is the right size for what I should be, and it's working. And so like I've continued to be able to lose through this, and then maintain through the holidays and all that kind of stuff. So
Mm-hmm. Yeah, to kind of add too, like I always wanted to almost challenge myself to not have leftovers or not take food home from restaurants, and that's completely changed now. Like if there's food on my plate, I don't care. Like if it is something that goes in the garbage or it can be left for later, then it kind of just comes with the territory. And I think that's really been what's helped me the most, is to change, like, being okay with leaving something. I don't have to finish everything.
yeah.
Yeah, it's a huge piece for success, that mind shift of like, I'm okay. I'm not going to die. I'm going to survive the winter if I don't clean this plate. Cause like that is like you mentioned with your mom saying like, oh, that is like a very deep seated piece of biology of everything that's alive on this planet, is that life is hard, resources are scarce. And if you do not store up every time you get a chance, you're going to die. You're not going to make it. And
It's a rough winter.
yeah, it's hard. So like along that lines, like how has having surgical weight loss affected your social relationships? Because so many of our social relationships do revolve around food. What were your fears of, and how have those things changed?
I think if anything for me, my social relationships have probably gotten better because I'm a little bit more outgoing from losing the weight. But when it comes to eating, like I'm okay with just asking somebody if they want to split, or like me and Mike, if we go out when we're together, we just order something and then share the food together. Um, but it definitely, uh, I guess, makes me more outgoing. With my family, it hasn't really changed um, in like a negative way. Like they're totally, I've had multiple people in my family who have had bariatric surgery in the past, back in like the 90s. So it was, I think it was only the gastric bypass.
Yeah.
So there wasn't kind of the other medical advances that have changed some of that. And so they were all, super supportive and on board when I talked to them about it. There wasn't like, I feel like I got judged when I told people who weren't my family about doing the surgery. And, almost kind of making it seem like I didn't need to, like it was their choice or something like that, and trying to reassure me that I wasn't as big as I was, or maybe not as unhealthy. So, but my family was totally cool, and they're, of course, my mom does the mom thing where she wants to see if I'm okay, but um, she's not like trying to force it, or she's not thinking that I've gotten too skinny or anything like that either. So, I just think that it has been a great thing for me just with my friendships and my mental state that has made me a little bit less of an introvert in certain situations, even though that's kind of like my default setting is to be introverted. Um, it's helped me to just be, you know, kind of more happy or lighthearted or fun, fun for those kind of scenarios. And I just work around the food part.
Yeah.
That's super cool.
On my side, it's one, doing this with Charles was a really easy thing because when we hang out, we're in the same boat. And so like we didn't like had he not, I know that that would have been a challenge given that our like what our previous relationship was built off of and how we hung out. Food was involved in a lot. And so like, but the fact that we've been on the same page since day one, like when we do hang out, it is just easy because like he said, like if we need to go eat something, like we'll cook or we'll go out somewhere and I'll either share something with him or with my wife. And like that I think has been nice is from my wife's standpoint because while she didn't go through surgery, me doing this, she's been aligning with me, and so she's gone kind of through her own journey, which has been kind of incredible because we're leaning on each other for support in that way too. But like I guess the biggest difference is I've always been more outgoing and social. So my fear was like, what was that going to be like? And in all honesty, it's just not around a food table. Like when there was a get together, I'm just not standing there eating. I'm like just more doing just the social aspect. And I played a lot of golf this summer, which was great because like the recovery of my body has been so much better with the weight off. Like I can do more from that standpoint. Where like after a round of golf, like I would come home and be sore for the rest of the day, if not the next. And now I can go do that and then still have time to go do stuff with the family afterwards and those kind of things. So like which has just made me want to do it more. So it's just improved and it's slightly changed a little bit.
What I feel like we've already talked through some of the challenges that you guys have seen or been through. Any other big challenges that we haven't already talked about?
One for me is I would say that like I didn't expect, or the challenge I've had is like my fear of failing. Because before like I did not have a healthy relationship with food prior to surgery. And the follow-up meetings that I've had with you, Dr. Tan, and then also with the nutritionalist has been really, really helpful because I can talk through some of those things and know that I am gonna eat at holidays and those kind of things, but it's not like it's not like I'm just going and reverting back into what I've done because, but my mind kind of goes there. So I think that part I didn't expect to be a challenge, and so but that's just more me and my relationship with food. But I'm also getting through it, which I think is helpful. And then I would say the other part is really learning how to go out, like just dates with my wife, or those kind of things at first was really challenging, because normally a date, we go out, we'll have dinner and get some drinks, and then we would get there and it's like, well, I can't eat any of this. And so just planning things like that, the learning curve there was more challenging than I expected. And it wasn't something that I was planning when it came to like how I was going to get through all of this. But not anything that I wasn't able to work through.
Yeah, I mean, to be completely honest with from my end, I don't feel like it has been as challenging as I thought that it was going to be. I think that I always had this fear that if I did it, my whole life was going to be so different, and things were going to be so hard, and I was going to constantly have to worry about this, or I was going to have to cut out all these things that, I thought that kind of I needed. And for the most part, it's been fairly, I don't want to say easy, but yeah, kind of easy. Like we made the choice, we did it, we got through the pain part, and then, learning the portion. And then kind of from there, I just feel like with Mike, we've kind of embraced it, and we're just kind of like moved on from whatever the old life was. And so, it's been pretty great all around, I feel like. And I'm like thrilled that we did it. And I think I was always afraid that if I did, it would be something completely different. And it's been really just kind of amazing all around. So, yeah, I don't really have any other like challenges. Maybe being, too good looking now. Maybe that's the only challenge, but but yeah, it's been pretty great.
I think there's sometimes a fear of, well, first of all, fear of failure is that's super common. I hear that from a lot of my patients, because you have tried before in the past many times and it's not worked. And so finally having something that works, it's very normal to feel that way. But I also often hear people afraid to say that it has felt easier than they thought, because the view of, one of the misconceptions about surgery, I don't know if it's a misconception, but a lot of people will say surgery is the easy way out. You took the easy way out, you cheated. And there's nothing wrong with making something easier. It's okay that it was easy, right? That's what we were hoping for. And
I'm pretty happy with indoor plumbing and electricity. My power tools. Like,
I mean, you guys still put so much
perfectly
work
happy with
into it.
all
Yeah.
of those things. Yes.
So, that's not to discount all the work that you guys have both put in. But yeah, it's kind of what we were hoping for.
Right.
Exactly. Yeah, we get in our own heads, I think, for everything. And so having something that kind of helps to almost get yourself out of your way, I think does really help in the long run. And yeah, you said it, Dr. Tan, that a lot of people think that you just took some shortcut, or you just, you only did that because you didn't want to put in the work. Well, we have to put in the work every day still. And you can fall back on old habits, and you can, still stretch out your stomach. And we have to constantly think of that. But it's also not something that I try to not obsess over it, because if I did that, then I think that I would be, a little unhappy with just trying to live my life the way that it is now. So yeah, there is constantly, mental challenges and blocks that get in our way, but it's been nice to have that tool to help me move past some of my old habits, for sure.
Charles has been a good person to walk me back on that ledge, to that point of like, I get in my head, and he's just like, look what you've accomplished, look where you're at, stop, and it's like, yeah, okay, reset.
Very cool. Along that lines, what has been your guys' biggest wins since having weight loss surgery? Charles, you start.
Again, just to reiterate my mental health, like some of the physical stuff, like I have back problems, and that has gotten a little better, but I think the damage has been done to a certain extent in that area. So I'm trying to work through that, and I bounce back quicker. But just mentally, I don't think I really was prepared for how, I guess, I viewed myself, especially since after surgery. And not that I'm definitely still not somebody who wants to be the center of attention. And, I kind of default to, deflecting attention to other people, but I have also been much kinder to myself throughout this process. And I think that has been the big thing. Trying to give myself grace, and then also just seeing myself as, you know, somebody with worth. I mean, to be completely honest, for a lot of years, I didn't, I guess, feel that way. And that's what made it a little easier. Now I'm getting a little emotional, but, life isn't always easy. And so if you're beating yourself up, it just makes everything harder. So mentally, it's just made me just feel different. And I'm still, I'm kind of like, people tell me that I'm the eternal pessimist. I try to kind of work through some of that. I feel like I'm a realist for most of the time, but I think that it's helped me to be a little bit more positive in certain situations, and then also trying to help support other people and make them feel like okay with where they're at too, right? Because we all have different journeys and have to work through things. But just mentally, it's changed a lot of how I kind of view myself and the world around me, for sure.
Yeah. Thanks for sharing that, Charles. I think as a bariatric surgeon, that's my favorite part of my job too, honestly, it's the mental part. And I had someone say it really well, and they said, this journey has changed the story that I tell about myself and who I believe that I am now and what I am capable of doing in my life. And I think, like you said too, like what I'm worth now. And thanks for sharing that. It's really cool. Mike, what has been some of your biggest wins since having weight loss surgery?
Yeah, I definitely go a different route than Charles. For me though, like it's my energy levels that I didn't like. You should naturally kind of expect it, I guess. I didn't like the amount of energy I have on a day to day now, especially after doing something physical. It's shocking at times. Where like before I would get tired after something after I don't know, an hour or so, and I would look for ways to get out of it or postpone it further or things like that. And now I just get it done because I'm not tired yet. So that is probably my favorite thing. The health stuff obviously is good. So like getting off of the other medications and not having that fear of or concern that those are problems anymore is pretty amazing, especially how quick it was is great. And then like, I'm not gonna lie, going to a store and being able to grab a large shirt and know that it's gonna fit has been like probably one of the best things, because clothes shopping has always been kind of awful because you never know what's like, is this brand gonna fit or is this, and like my wardrobe has changed more to things that I actually want to wear versus what I have to because of my size. And so like all that stuff has just been giant wins.
Awesome. So cool. Thanks for sharing, guys.
I see a question that someone sent in, and it was just asking if you all had the sleeve or the gastric bypass, which, if you're comfortable with me sharing.
Yeah.
You guys both had the sleeve gastrectomy.
Yeah, sorry.
I guess we should have maybe talked about that at the beginning, but congratulations, guys. It's been very cool to see you guys in this last year and see how things have changed and hear about your amazing wins. Any regrets about having surgery?
Probably like the normal one. Like I wish I would have done it sooner.
Yeah, I was gonna say something.
But like, I mean, that's kind of the reality. Like as soon as we did it and we started going through it, like that was kind of my mindset. Like I was always afraid that, like you kind of mentioned it earlier, that like this was the easy way out. And it took me doing it to learn that this was the tool that I needed to succeed. And Brent, like you kind of like made the call out of like, we like things to be easier and those kind of things. And I always looked at it like, and that was what I postponed it the most, is I didn't want to feel like I was going to fail. I hate that. And the funny part is I do this and now I feel like I'm succeeding because I'm at the weight like I want to be, and those kind of things. And so like, I think that's the piece for me that was the biggest one, is I wish I would have got out of my head or had a conversation where someone would have explained it in that it's a tool more so than a failure. Because I wish I would have just been happier longer.
Yeah, I don't regret it at all. I mean, I think I probably maybe regret not doing my research beforehand more to know that there were different versions because I still had the idea that it was only like the gastric bypass. And I think that's what freaked me out initially of like not wanting to go that route because that to me is a little bit of a bigger surgery or just, different kind of way to take it. And so um, like Mike was the one who even brought up the gastric sleeve part, and I didn't even realize that there were multiple different ways. So I think if I would have just been more informed, then I could have again maybe done it earlier, but just know that there's different tools for different people, and not every tool is going to fit the same um, scenario. So like knowing what options are even there.
Yeah, Lizette, our commenter, she had a little update. She said, "That's great. I have PCOS, have my surgery date in February, and I'm nervous, but I know this is the best decision for my health."
Congrats.
Let's
Yeah,
go,
awesome.
Lizette. Hopefully, I'm saying that right. Or, yeah, cool, nice. No, that's super cool, man. Thanks for coming on, guys.
Yeah.
Of course.
Awesome. All right. Yeah, I think we are going to wrap things up then, but congratulations. Happy
Thank you.
1 year. Congrats.
Yeah.
Yeah,
And thank
Yeah.
I
you.
mean, thank you guys for also being so awesome. Like,
Right.
I think even on like just the day of surgery, how um cared for I think that I felt, or just being in the rooms and having your guys' whole staff looking after us. I think it's been pretty awesome. I mean, me and Mike make jokes that, we get too many notifications when like we have something upcoming, but at the same time, it's nice to know that you guys actually seem to like truly care about the patients and kind of what we're going through. It's been really great. So, I love spending time when we do have those chances, and it's nice to connect, and you guys have just been really, really great throughout the process. So
yeah. It's I do say our goal is that we make you sick of us. Yeah, like you can't get away from us. It's
right.
Sorry.
Hey, one thing I don't think we really talked on much though. I'm sorry if to just take another minute. Mike, what's been the experience like from doing, like a GLP-1 injection before
Yeah.
surgery and then having the surgery afterwards? Like how do those compare? Because there are literally tens of millions of people out there that have done the injection and they're like, I can see where this is helpful, but it just didn't take me to where I needed to get to. Like
Yeah.
what's kind of been your experience?
I mean, that was kind of the straw that got me to do this. Is I tried the GLP-1 thing, and it wasn't working in the sense that I thought it would, or it was having the same impact that it had with others. And in my mind, I knew that wasn't going to be a forever answer. Like even if I lost the weight, if I got on it, I got off of it, like then what's going to happen? And then also the cost, I think is the big one because this was a year ago or so ago. So even then, like it was even harder to get it approved through like insurance. So it was out of pocket for me, and I knew I wasn't going to be able to sustain that forever. And so that was kind of the caveat. But as far as like the way I feel and all of that, surgery, like I actually worked. Like the medicine was there. Like when I was on it, like there was like some craving pieces that would go away. But I could also, if I wanted to eat, I just could, and I could just go past that, especially if I was in something like I was in a bad mood or something like that, and I was falling back in. So I think the two things I would say is one, I didn't learn the right way to manage like a healthy relationship with food by using the medicine. It was just like almost like a band-aid, where I not only did the surgery come in, like I kind of said before, like we were having the follow-up meetings, we were like meeting with the nutritionist, like that helped a lot in that relationship side of it, to be healthier in that way. And just the fact like I could only eat so much. So even if it was like that emotional day or whatever, like that kind of stuff kind of went away because it wasn't something that I could just mentally plow through or break through. It was like I would just like feel awful, and I like that's not a good feeling. So
Yeah. Thanks for sharing.
yeah.
Guys, again, Dr. Tan, great work. Guys,
Mhm.
incredible work. We're all a team here at Aviva, and it takes you know, it's a journey. It's a process. You need all the pieces together. You need all the pieces together. It's been really cool having a conversation with you guys. And if you are out there and you're struggling, you know, like know that you are not alone. And this is the disease. This is the disease and the challenge of our time, honestly. And our bodies are not made to live in the 21st century. They really aren't. So if you need help, reach out. EvivaMD.com should be in the description somewhere around. And yeah, love to help you guys. Thanks again so much for coming on, guys.
Of course. Thank you.
Thank you.